Welcome to a basic introduction to mechanical ventilation. This is chapter 1.1, Airway Anatomy. Today we're going to cover the anatomy of the airways as an introduction to mechanical ventilation. All of the action really occurs in the lower airways, and what we consider the lower airways is everything that's below the vocal cords. It starts with the trachea, which is a long tube that basically splits off into two bronchus, left and right mainstem bronchuses. And the trachea and both of those mainstem bronchuses are buttressed by a cartilage splint that's C-shaped. So when you look at an airway, you can see that when you're looking down the airway, you can see it as almost an upside down D because the cartilage forms an arch at the top of the trachea. The lung itself is divided into lobes. The right side has a right upper lobe, a right middle lobe, and a right lower lobe, whereas on the left side there's only two lobes because the heart kind of gets in the way, and so you're left with just a left upper lobe and a left lower lobe. Now there is a smaller lobe associated with the left lower lobe, and this is called the lingula. The bronchus continue to divide after the left and right main stem until they reach the level of the alveoli. And this is where all of the action occurs. This is where gas exchange occurs. The alveoli are basically an air sac surrounded by blood vessels. The sole responsibility is to exchange gas, most importantly oxygen and carbon dioxide. The alveoli itself is only one cell layer thick. The capillaries are only one cell layer thick as well, and so there is really effectively only two cell layers between the air and the blood interface. There is an interstitial layer between the alveoli and the capillaries, and these are there to provide structure to the lungs and support both the alveoli as well as the capillaries.